Good morning, and thank you for joining us. I'm Dr. Michael Johnson, Director of Community Health for the Southern Nevada Health District. Currently, the Southern Nevada Health District is reporting 2,738 COVID-19 cases in Clark County, along with 124 deaths. We're also reporting that we have 1,515 individuals who have recovered. Today, we also began providing additional information on our website to our daily case summaries, and this includes basic demographic information as well as medical history for information that's available. I'm joined today by Dr. Whit Krashauer, our medical investigator, and Jeff Quinn, our manager of the Office of Public Health Preparedness. We'd like to open it up to questions now. Corey Burgess will moderate this session. Dr. Krashauer and I can answer questions about the data, laboratory capacity, and our case investigations. And Jeff Quinn can take questions about our ongoing preparedness efforts and our efforts to secure and distribute PPE. So at this time, let's open it up for questions.
Thank you, Dr. Johnson. Our first question comes in from Megan.
Megan Messerly. Oh, hi, this is Megan Messerly at the Nevada Independent. I have a couple of questions for you all. The first one is I had a question about contact tracing as far as the number of staff right now that you have devoted to contact tracing. And I know as we talk about, maybe opening up the economy, returning back to normal, we know that we're going to need more robust contact tracing. So I'm wondering if you have any sort of estimate of how many more people you might need or any extra funding you might need for that. That's the first question. I'll give you the second question after. Yeah, well,
Megan, that's a very good question. As you might imagine, we're really overwhelmed with the amount of contact tracing that we have to do. I believe we have at least 50 individuals within our Office of Epidemiology and Disease Investigation working on this, as well as several other staff who have been cross-trained that are helping to provide support for this as well. But we, like many other health departments around the country, are really in need of additional disease investigators to keep up with all the contact tracing. I don't know, Whit, if you'd like to add anything.
No, I think you said it exactly right, Dr. Johnson. I think we have a good team working on this. We have a lot of people working on this, but could we always use more people? Certainly.
Absolutely.
Our next question comes from the phone number ending in 2962.
Hi, it's Dana Gentry from the Nevada Current. Is there a level of testing saturation in the community that would make you feel confident about reopening the economy? Is there like a percentage that you can cite?
You want me to answer that?
Yeah, why don't you do it?
I think we can't give like a certain number that would make us feel comfortable about opening everything up. I think it's really about when we have people that we want to test, even people with milder symptoms, do we have the capacity to test those people? And that's always been an issue throughout this. So, but we can't put a specific number on that. I don't know if you want to say anything else, Dr. Johnson.
No, that captures it. Obviously, it's not the first time that it's been reported, but we are in great need of additional testing supplies to increase our capacity. We rely on commercial labs as well as our own capacity with our Southern Nevada Public Health Lab, which currently has the capability to test about 100 specimens a day. We have approximately 5,800 tests available as of today.
From the emergency management perspective, we are coordinating with ramping up testing that we have available here in the community. And so really working through our county emergency managers and jurisdictional partners such as UMC, we're trying to increase local testing capability that we have. Right now, that's a combination in partnership with commercial labs and reference labs that would include Quest, LabCorp, CPL, and others. So really, it's a multi-pronged approach to getting enough testing capacity here. but part of the governor's task force and the governor them across the country is working on a plan to gradually reopen the community. And really, we just a lot of unknowns still yet, whether we start lifting those restrictions, whether we'll have increased infection rates. But right now, testing is still reserved to the CDC priority groups, which are those that are all three of those, the top priority groups requires people to be symptomatic. So there's not testing available in the community for those that are asymptomatic or anybody that wants them at this time.
Our next question comes in from phone number 7309.
Hi, this is Michael Davidson from the Las Vegas Review-Journal newspaper. The new data that you guys put out today regarding demographic data for deaths for the first time shows that a few different groups are being disproportionately affected by the coronavirus and dying of it. Age 65 and older, I think that's one that we all expected. But what sticks out to me are Black residents, Asian residents of Clark County, and men in Clark County are dying at rates higher or larger than their percentage of the population. I was wondering if you could offer any insight at all into what might be leading to these trends.
Well, certainly we've been looking, given the disparities issue, at our race, ethnicity data, and African Americans in particular. And the population demographic for African Americans in the state of Nevada is around slightly over 9%. In Clark County, it's around 12%. If you look at the COVID deaths for African Americans, as we posted today, as you mentioned, it's about 16%. So it's slightly higher than the 12%, which we're also seeing across the country. Some of the reasons for this that have been put out there is some of the underlying medical conditions that certain minority groups, including African Americans, have, such as diabetes, hypertension, chronic heart disease, which are many of the underlying conditions that we're finding in both our hospitalized and with our mortality data. So this is consistent with data we're seeing across the country. We've also noted the increase in males and in Asians, and Whit, you may want to say a couple things about that.
Yeah, I think the increased mortality in males is something that's also being seen across the country. This is something that I believe was also seen in China, and it's a complex thing to tease out. I think for many different infectious diseases, there does tend to be a pattern of men being more heavily affected, but it also could very well be due to lifestyle factors. So in China, one of the things that was reported was that a much higher percentage of men smoke than women. So it's for both gender and race ethnicity, it can be hard to tease out the different factors that can lead to these disparities. Something else I'd like to note is that seeing that a certain race ethnicity is underrepresented can also be a bad sign. For example, we're seeing lower cases in people of Hispanic descent, and that could be good news, but it could also be related to undertesting, and so it can be really difficult to parse out this information and interpret it, especially given how many cases have missing data.
We have a question now from Mary Hines. Where do we stand in terms of having a robust testing program for healthcare workers and other gateway criteria for proceeding to phase 1?
Let's see.
Well, I think with testing that we have for healthcare providers, they are part of the CDC's priority group for those healthcare workers, first responders that are supporting our community response to COVID-19. So could there be more? Always yes. I mean, it's a definitive yes. We need more testing capability, but we also need more personal protective equipment as well. Any of the testing sites that they've done across the country has demonstrated the need that the correlation between the testing capability and having available PPE for those healthcare providers that are actually doing test collection. So most of the community sites are as far as test collection. Now, testing capacity, the labs, both private and public that we have, we need to be able to increase our capacity. Unfortunately, because it's a pandemic that is impacting every city and community and state across the country, many of our large commercial labs are actually doing testing for other states as well, which lead to increased turnaround times for those test results, which sometimes can, be difficult for the healthcare provider that is using the test results to modify the care that they're providing, but also for first responders and individuals and the healthcare providers themselves to get the results back, whether it's positive or negative, and what the next steps are.
We have a follow-up question from Megan.
This is Megan Messerly again with the Nevada Independent. My second question was, and I'm going to caveat this with, I know you all are incredibly busy and probably have not had a chance to dig into the nitty gritty of the data, but with the new zip code data that you released today, I did a per capita analysis of the zip code level data, and it looks like the zip code with the highest concentration by far, it appears to be double what the other zip codes have, is the 89109 zip code, which looks like the Las Vegas Strip. Obviously, it's only 30 cases. It's a very small population zip code. Not a lot of folks live there. It's probably mostly condominiums, I know, based on the Clark County data we have on what those residents are. I'm wondering if you have any insight into why that zip code might have a higher concentration of cases, if we have any sense of these are visitors who might have listed their hotel address, or is there an outbreak in the condominiums? Do you have any sense of why that zip code might have a higher concentration of cases?
Not really at this point in time, Megan. We haven't really drilled down into a lot of the per capita analyses. And there could be a variety of reasons why we're seeing higher rates in some of these zip codes. I will note that our highest range, 70 to 94 cases, includes zip codes 89030, 31, 108, 110, 117, and 148. Those are the ones with the highest number of cases at this point. But just given the work that our disease investigators and staff are doing on trying to keep up with cases and deaths, we haven't been able to drill down to that.
And I can also say, without having really delved into the data too much regarding zip codes, the normal practice is that when we have a case reported to us and we investigate the address, we take the address as the person's residence. So not where they're currently staying if they're staying in a hotel, but where they usually live. So it would be expected that visitors would have their original geographic zip code, and it wouldn't be a strip address.
Yeah, correct.
We have another question from Dana.
Hi, are there any faster tests coming on market? I know that you closed down a couple facilities that were not licensed and providing those types of tests. Are there any more that you know of that are legitimate?
Yes, we've actually, the health district has actually received 8 Abbott rapid testing machines, and we'll be retaining 3 of those here for use in our FQHC, or our federally qualified health center, and for outreach. One of the machines will also go to UMC, and 4 will be distributed to community FQHCs. And these are approved rapid testing machines, which can turn around results in a much faster time.
In the chat box, we have a question from Lauren Clark. As you know, the president has unveiled a 3-phase guideline for reopening the country. In your medical opinion, do we even meet the gating criteria for proceeding to phase 1?
Oh, Whit, you want to take that?
So I haven't actually looked. I mean, I'm not as familiar with the president's criteria for reopening community at this time, so I can't speak on it.
Mary Hines has another question. With cases leveling off, is the community ready to begin reopening?
Well, we're very careful about making predictions about cases, any kind of downward trend or even leveling off, because there may be delays in reporting cases. And as we all know, there's been limitations to our ability to do widespread testing like we've been discussing. So we're not, it's premature at this point to talk about downward trends or leveling off, but I can tell you that we're watching the data very closely, obviously daily, and we'll be reporting on this routinely as we do, so we'll keep you posted.
I just wanted to remind everyone, if you have a question today and you're joining us online, use the raise hand button, which is at the bottom of the participants list, or put your question in the chat box. But if you're calling in, you can hit *9 on your phone to raise your hand. Do we have any further questions at this time? Orko Mana is asking, for those groups who are being disproportionately affected, such as African Americans, what efforts are being made to ensure that enough testing is being provided in those communities and that they have access to testing consistent with the rest of the population?
Jeff, I know you may want to respond to this. I know there's been some outreach planned for Latino and African American communities.
Right, and as we, I mentioned previously, working with emergency managers to identify testing site locations, and it's kind of deceiving because it's not a testing site location as much as it's a collection site location in these communities. But really, it gets to the heart of another question, which is access to care. So right now, if you look at who is typically getting tested right now, based on the CDC priority group populations, it's people that are symptomatic, and the locations of actually where they get the testing is either through their private provider offices, the emergency room, and the various hospitals across town. So, you know, with that contingent upon the availability of having enough tests available to test individuals, you know, it also raises the questions about access to care, and really, do we have enough access to care of our vulnerable populations and those that, based on the data, we're seeing an uptick in maybe some disproportionate reporting of those cases. But as it goes back to what Dr. Kreschauer was saying, it really doesn't tell us much because of the number of tests and the access to testing services around the community.
Okay, we've got another question from Dana.
Hi, in South Korea, more than 100 patients who were said to have recovered have tested positive again. They say that is a reactivation of the virus. Can you explain that, how that happens, and how that complicates your efforts?
I can speak on that. What we do know is that for people who test positive, there's a certain subset of them who seem to continue to test positive for a long period of time. And so we're seeing situations where, someone previously tested positive and now a period of time later, they're testing positive again. And it's hard to know whether these people have a new infection or whether they just continue to have traces of the old infection. We're not exactly sure with this disease how long immunity lasts. We suspect that there's likely some short-term immunity, but as far as I know, that we still don't have any concrete data on exactly whether short-term immunity is months or whether it's like a year. So yeah, these are things that we definitely want to know more about. I think as time goes on, there's going to be more detailed sort of genetic analysis. They'll be able to parse out the difference between if someone continues to test positive, is this a new infection or is this an old infection? There's also an area of controversy in that for people who test positive for a long period of time, are you testing, so the test is like a PCR for virus RNA, and are you testing a viable virus, or are you just testing viral fragments that are not viable anymore, but continue to be persistent in people's like nasopharynx or oropharynx. And so there's still just a lot of unknowns.
Lauren Clark is asking, you're all monitoring the numbers closely, but where does Nevada stand on the curve in your medical opinion? Are we past or approaching the peak?
Well, there's a lot of models out there, as you're aware, and the models are only as good as the assumptions that go into them. In looking at our data, it doesn't appear that we've reached a peak, although with some delayed reporting and other things, it's difficult to determine that at this point in time. So we're continuing to closely monitor this.
And really, from working with our healthcare system partners and our community partners, separate from the numbers, we're also monitoring surge to emergency departments across the valley. And the kind of favorable news is that social distancing does work, and it is working, I think, consistently across the country to slow the spread of new cases of COVID-19. So really, we can't use just the data alone. Really, we have to reach out and communicate with our community partners and make sure that our emergency departments are not seeing above normal surge as it relates to people presenting with signs and symptoms of COVID-19. So that is one thing that we have established in our community, is the communication pathways between multiple entities to try to be able to monitor potential increase in infection rates. We're looking at statistics as far as hospitalizations, the number of individuals being intubated, and which all give us a bigger, more broad picture of what is actually occurring within the community as it relates to COVID-19.
That's right. And to add to Jeff's comments, 3 of the many indicators that hospitals are collecting on their capacity have to do with percent of beds occupied, percent of ICU beds occupied, and percent of ventilators in use. And it has been stable, as Jeff mentioned. We're looking, as of today, at 65% of beds occupied at hospitals here in Southern Nevada, 77% of ICU beds occupied, and 44% of ventilators in use.
One thing I'd also like to say is that there's about a 2 or 3 week lag between when we see a new case and when we start to see new deaths. And so, even if we start to see a leveling off in new cases, that doesn't necessarily mean that you're going to have an immediate leveling off in deaths and hospitalizations. So that's why I think it's really important to remain vigilant and to keep promoting this social distancing.
Absolutely.
Mary Hines is asking, is the district preparing to do antibody testing?
Would you like to speak to that? Sure.
This is an area that we're very interested in, but I think there's still, again, a lot of uncertainty. Some of the things that I've discussed in the past is that we're not sure how long immunity lasts. I think there are different tests on the market. One of the things that concerns me is that for some of the tests I've looked at, there's a high amount of cross-reactivity with other coronaviruses. So people could get the test. It may say that they've already had the novel coronavirus infection, but it could actually be related to one of the coronaviruses that circulates in the community and causes, more like common cold symptoms. So I think until we get more information, I think, it's not going to be something that we're heavily promoting at this time, but I think it's something we're definitely trying to keep our finger on the pulse of what's going on.
Yeah, absolutely.
Our next question is from Ronia from Fox 5. She's asking, will you provide plasma donations?
Could you repeat the question? I'm sorry.
Will you provide plasma donations?
That is something we'd have to get back to you on. It's not something that we've discussed internally yet.
Next up is Michael Davidson.
Hi there. You guys had mentioned the data about the hospital's capacity. Are you guys receiving that directly from the hospitals each day? Are you receiving it from the Nevada Hospital Association? Is it just for Clark County? Is it for the entire state? What is your office receiving directly, and who are you guys getting it from when you're keeping up with those stats?
Right. We receive it from the Hospital Association daily, and it's for all hospitals in the state. And then it's broken down for north and south and rurals and so on. So it's a comprehensive list for the state. And I know, Jeff, you deal with this daily, so I don't know if you have anything to add to that.
Right, and we centralize the communications so that leave our healthcare providers to be able to respond instead of providing not only the health department and other people information that allows them to continue to do the important work that they do. Early on, we kind of streamlined the communications through the Nevada Hospital Association as a one-stop shop to request, resources so hospitals are familiar with the individuals requesting information. Now, that being said, as we're monitoring the situation, if we need additional information that is not currently being reported, we will coordinate with the Nevada Hospital Association to make that request to hospitals to get the information that we need.
Esther McConnell is asking, New York has required all people to wear masks in public. The amount of cases in Nevada isn't close to New York, but would you recommend that people continue to wear masks in public?
Yes. Well, the health district continues to, members of the public follow the guidance of the CDC to use cloth face masks in public. Recent studies suggest that individuals with coronavirus infections can transmit the virus even if they're asymptomatic. So it's important, and our recommendation is continue to wear cloth masks in public when you go out, such as to shopping or the pharmacy.
And it's a good, a lot of the PPE is a good reminder. Once you have the respirator on or the mask on your face, the surgical mask, that it reminds you not to touch your face. So when you see some of the symptoms about increasing hand washing, not touching your face, covering your cough, and those kind of things, it's a good reminder as a preparedness tool to have that on available. It does, assist with if somebody is infected with COVID, that if they sneeze, it provides a sneeze barrier. So, all this stuff compounds in the bigger picture of things to limit the spread of COVID-19.
And, in addition to masks, as has been said here and said many times, we can't emphasize it enough that maintaining social distancing is really probably the most important method of slowing the virus that folks can take.
Next question comes from Dana Gentry.
Hi, can you tell me if the health district is doing anything to assist group homes, senior homes, assisted living facilities, or other facilities that have positive cases? Are they handling it on their own?
I can speak on that. So when there are cases detected in those sorts of facilities, that's actually regulated by the state. And so the state leads those investigations. The Southern Nevada Health District is assisting the state with those investigations. So currently the lead role is taken by the state. The Southern Nevada Health District is trying to extend basically the resources of the state by helping investigate contacts of those individuals within the skilled nursing facilities and things like that. So if there are patients who have the disease, the state will lead that investigation. If there are family members and stuff outside those skilled nursing facilities, then Southern Nevada Health District takes that on. So we're really just trying to work together as best we can, but these facilities are not being left on their own to deal with these.
That's right.
Lauren Clark is asking, looking at the data, what is your biggest concern for our state in the next few weeks?
Well, our biggest concern as it remains is that cases would continue to increase, that mortality would continue to increase, that hospital capacity would reach surge levels. Those are really always our biggest concerns. So, we watch the data very closely, and we try to be as proactive as we can with our preparedness efforts and our outreach to do everything we can to get as many people tested as we can, get as many people into treatment as we can, and to continue to promote the messages of social distancing and precautions that people can take to prevent infection.
And I would also say, I think, this is a once in 100 year sort of situation. So I think we look back to the 1918 influenza pandemic, and they saw in that pandemic that, the second wave was more severe than the first wave. So, even if we start to see a leveling off of cases, we don't want a situation where everyone thinks that, they're home free now and they stop social distancing and all those things, because we want to remain vigilant, and we want to protect against a second surge if we see one. We still don't know if we're out of the first one, but in the long term, even if we saw a leveling off of cases, we'd want to remain vigilant.
Absolutely.
Orko Mana is asking, speaking of the data, have you seen any signs of the situation in Southern Nevada starting to improve?
Well, we watch our cases, as I've mentioned, very closely, and we're looking at trends very closely. It's really premature to say anything about plateauing or downward trends. One of the things that is encouraging is that we in looking at our data, we're beginning to see, I think, social distancing really working. And to Whit's point a moment ago, I think it's important for us to continue to remain vigilant, because the last thing we want is to try to eliminate or reduce significantly social distancing and a number of the other precautionary measures too soon, so that we have a rebound effect that could even be worse than the current situation that we're in now. But I think the promising things is the majority of people appear to be listening and adhering to both the health district and the governor's recommendations on how to behave responsibly during this outbreak. And that's very, very encouraging to see how this community is coming together to do that. I think it'll make a difference, a big, big difference in the long run.
Also, we're using the downtime with the favorable and encouraging things that we're seeing in the community to do better. I mean, really, with all of our operations, this gives us some breathing room to really continue to be vigilant, and community coordination and collaboration with our partners to do more effective communication, and to continue on, as Whit referenced before, about planning for the next phase. Even if we don't have a crystal ball to speculate on that with what we're seeing, but we have to be prepared as a community to manage the surges as they come. And right now, we have a good opportunity to increase testing capability and capacity, to identify more available beds within our community that we can place patients into if we need to provide some isolation and supportive care. So really during this time, we are looking forward and really kind of analyzing, some best practices and lessons learned from the recent few weeks, and try to incorporate those into our planning that we're doing for future activities.
Dr. Johnson, I'm seeing no further questions at this time.
Okay, thank you. Then we could wrap it up. We thank you for taking the time today to join us, and we'll continue to keep you posted as new news develops. Thank you all very much.
Thank you.
Thank you all. Thank you all for attending today's event. If you have further questions, please reach out to our Office of Communications. Have a safe and healthy weekend.